Ladies and gentlemen, welcome to It's Rainmaking Time. This is Kim Greenhouse. It's a great pleasure and an honor to welcome Dr. Hal Huggins. He is known by many as the father of Mercury Free Dentistry. He was trained at the University of Nebraska in 1962, and in 1973, he noticed that mercury toxicity and human health had a connection. He has a Master's of Science at the University of Colorado in toxicology and immunology. He is the author of It's All in Your Head, Uninformed Consent, Root Canals, Savior or Suicide, Solving the MS Mystery, Protocols for Amalgam Removal and Detoxification, and Detoxification Revisited. He is a pioneer in the field, and it is my great pleasure and honor to welcome Dr. Hal Huggins to It's Rainmaking Time. Good morning.
Well, good morning. Thank you, Kim. That's quite an introduction there. I think I'd like to listen to the program myself.
I'm delighted to have you on the show. A new dentist that came into my life wants to immediately do a root canal. What's the synchronicity of that coming up before the show?
Synchronicity, yeah, it did happen there. And do you believe in coincidences?
I definitely accept that coincidences are a function of synchronicity and divine intervention.
Yeah, well, there may be a little divine intervention, which means that you just have to work a few more years. Because you get things like root canals, and, well, the one thing that Weston Price, one of the original people who did a lot of work in root canals, one of the things he kept mentioning is consistently people talked about brain fog, and in taking the root canal tooth out, the brain fog would go away. So, yes, you have, by not getting the root canal, you probably don't have to experience firsthand what is meant by brain fog.
You're sitting there with my blood chemistry. We're going to hear what you're seeing when you're looking at my blood chemistry of 4 months ago prior to this revelation.
Right. There are normal ranges from the hospitals and the laboratories, normal ranges of blood chemistries, blood ranges, and these values are based on what has been done in that particular hospital or that particular laboratory. And they usually take like 100 of them and average them together, and that comes out to be normal. Well, in a hospital, why do you go to a hospital? Are you going to a hospital today?
This was done at the Life Extension Foundation, and their values are typically higher than most places. They do a ton of research, millions of dollars of research. They're pretty advanced.
Yeah, they don't do the blood test. I'm talking
Right.
about the laboratories that do the blood test.
Oh, okay.
They farm it out to the hospitals and to the commercial laboratories.
Okay.
So normal is, if it's done from a hospital, it's where you got the blood drawn at least before the patient died. And that's what you're being compared to. So normal, by definition, includes 95.56% of the population. Well, I've got a clue for you. 95% of the population is not in good health. But we have been led to believe that normal means good health. It isn't. It means like all the rest of the people who are sick. So what we do is look for the ideal, which took a few years to figure out, because when you remove the challenges, the root canals, the cavitations, the mercury, the nickel crowns, and all this, then the immune system settles down to about the same place in everybody, whether you're red, yellow, black, or white. And this is what we use as a standard. And sometimes we have found a point, like with red blood cells. There is a point. And, there's the male range and the female range, because the females do this funny thing, so they must be abnormal according to the males who set it up. And it's not. If you remove all those challenges, the male and female range join and can come into a single point. So what I'm doing is looking at not the normal range. I started this back in 1968, studying blood chemistry, and the ranges have moved a lot since then, some of them politically and financially, like cholesterol, and some of them because they have new reagents, and some of them just because people are getting more challenges from dentistry. So like with white blood cells, The range used to be 5 to 10,000. Now some hospitals go as low as 2,800 and as high as 12,500. Well, in 1976, they came out, the Dental Association patented something called the high copper amalgam. And the high copper amalgam was supposed to keep its mercury within. And what it does, according to studies done in Europe, it releases 50, that's 50 times more mercury. And that's challenging to the immune system. Your white blood cells are your immune system. So you have them elevate to start with, and then they get tired and they go into the cellar. And that's what we're seeing as normal. So what we are looking for is, with white blood cells, 5 to 6,000. And you have 7,100 on your white blood cells, which means there is a challenge at that time. This was several months ago, but there was a challenge. And if you take the white blood cells, there are 6 different populations, they call them, of white blood cells, 6 different types that have 6 different job descriptions. And the point man there is the lymphocyte. And he goes out and says, here's a dead cell, here's a dying cell, here's a splinter, here's something that shouldn't be here. Puts a flag on it, and then the other white blood cells come in, pick it up, and haul it off and dispose of it. Well, your lymphocytes are not dangerous, but they are lower than I would expect them to be with a white cell count of 7,100. Well, who else is in on this war? If we look at a blood chemistry, the globulin is usually there to support the white blood cells if the white blood cells are not as effective as they should be. Because just because you got 7,100 does not mean you got 7,100 good live fighting soldiers. So the globulin should be at about 2.4, and it usually goes up to 2.8, 3, 3.2 if it's got a real war. And if it's tired, it'll drop below below 2.4, and yours has dropped down to 2.2. So this means it's kind of on the tired side.
Could that be from dehydration?
Not necessarily, because we're looking at grams when we're looking at the proteins, where the other chemistries are in milligrams, and there's 1,000 to 1 difference. So if you're dehydrated, you're going to see it more in the other chemistries than you would in the proteins.
Okay.
These are wheelbarrowfuls of protein. So it takes a lot to move that. But if we look a little bit farther, we find the key. And the key is the phosphorus levels are not indicative of how much phosphorus in your bloodstream, but the balance of the endocrine system, because the endocrine glands kind of pair up with and against each other. Estrogen, testosterone being one example. All females produce both. But when the phosphorus level goes up above 4, we may have some inflammation running around. Well, do you have anything that would create inflammation? A tooth that looks like it's pretty probably infected up there is inflammatory, which would make the white cells go up. Oh, well, they're up, which would make the lymphocytes go down because they're working a little bit too hard. Oh, they're down. The phosphorus would go up because of the presence of inflammation, and if it's been chronic, if it's been going on for a while, the globulin will go down. And in the process, the potassium level will be used up, and it will drop down below 4.5. If it's below 4.2, we better start looking cross-eyed at it, and yours is down at 3.9. So if we look at all things together, it does strongly suggest we better do something about that front tooth, or those front teeth, whichever is going on up there. But we need accurate x-rays and somebody who is not just anxious to do root canals and implants.
Is this not an accurate x-ray?
Well, it's just blown up.
Right.
It's like if you're taking a picture of somebody who is 2 miles away, it may not be quite as accurate as if he was across the room.
Okay.
But it does definitely show a shadow up there, which says, let's put the zoom lens on and see what we got going on.
Okay. You think I can save this tooth?
Do you have a safety deposit box?
No.
Well, you better get one, because that's a good place to save the tooth.
What does that mean?
that means you have to take it out and then put it in the safety deposit box. So then you can save it. But as far as saving it in your mouth is concerned,